food for thought. In 2002, the Royal College of Nursing in the UK surveyed 4,500 nurses, or actually close to 4,500, yeah. 17% of nurses reported being bullied by a staff member in the previous year. 41% identified that their immediate supervisor or manager is the main culprit. 33% identified a nursing colleague as the main culprit, and a little less than 30% of nurses who have experienced bullying and harassment were satisfied with their employer's handling of the situation, again alluding to unsupported work environments and mechanisms by which to recognize and mitigate the risk of harassment. And those who had been victims of bullying were twice as likely as their colleagues to be planning to leave the workplace. So some of the well-documented negative effects of workplace bullying and harassment: high rates of absenteeism, high rates of injuries and illness, increased short and long-term disability costs, increased EAP costs, and of course the WSIB costs, as well as, all of those other things that are very important to patient care and to healthy workplaces: decreased commitment, decreased productivity. Higher levels of client dissatisfaction actually has a direct result on patient care and patient satisfaction rates. Higher turnover and a worsened organization. Negative effects on the victim, the person that is being bullied or harassed. Lower levels of job satisfaction, psychosomatic symptoms and physical illness, post-traumatic stress, mental illness such as depression, and nurses have one of the highest rates of depression compared to any other profession, and permanent disability. So what is the profile of a bully? Low self-esteem, poor communication skills generally. Bully actually tries to cover up their own insecurities and weaknesses by, that power over others. Persons who have unresolved work issues from earlier in their career believe that they have the right to inflict controlling and abusive behaviors onto others. They're often viewed as charmers and actually well-liked by supervisors. Bullying behaviors are repeated by these individuals because the organization either ignores it or they don't know what to do about it. It's very difficult to enforce. It's very difficult to address a bullying or harassment in the workplace. And it's been my personal experience in working with organizations that they don't know that it's going on, or they choose to ignore it. So I think we have a lot of work to do in building this awareness. The behaviors associated with workplace bullying: social isolation, rumors, a personal attack of a person's private life and their personal attributes, excessive criticism, over-monitoring of work by a supervisor onto a worker, verbal aggression, withholding information, and withholding job responsibility. So how do we recognize bullying? It's often associated with ineffective management styles and the lack of presence of management. And certainly we've got some key issues in here. When you look at how many units managers are running, there really is very little presence of a supervisor in the workplace, which has a major impact on workplace safety, as well as the issue of harassment and bullying. Managers need to be aware of the impact, and again, I must stress that managers are not aware of the impact and often choose to either ignore the behavior that's going on in their unit, or they're not around to actually recognize the impact that it's having on their staff and on their patients and on the organization. The potential signs and symptoms associated with workplace bullying could be grievances, the number of grievances, looking at the issues of grievances, declining work performance of dedicated and hardworking employees. You suddenly have, this healthcare worker that has been notorious for doing a great job, and you've noticed changes in her performance, and she's not as committed, or he is not as committed and not performing up to standard. Stress and tensions between the staff in a unit, and being a previous nurse manager, when there's something going on, on the unit. You sense with the workers in the way that, they're getting along, or the absence of teamwork. So I think we have to pay attention to those symptoms. Poor morale generally among the workers. Reported fear of a coworker by other workers, and even that, you get on shift and there's that one notorious person that seems to pick on the others, and then it really splits the team apart. Individual symptoms of depression, that's a little harder to recognize. And then by unit, looking at increased absenteeism or transfer to other departments or units. So those are kind of some of the ways that you can actually examine prevalence in an area. So addressing workplace violence, employers have key responsibilities. It starts with a commitment of senior leadership, and actually before that, senior leaders need to be aware of what this issue is and the impact on the organization and ensure that they're committed to mitigating the risk of harassment and bullying. We need to create a culture with standards and values against bullying. And how do we do that? We need to define what acceptable behavior is. We need to ensure that our supervisors are accountable for recognizing and dealing with perpetrators of bullying and harassment in the workplace. We need to develop and implement anti-discrimination harassment policies in collaboration with the Joint Health and Safety Committee, unions, and frontline staff. And you know, organizations that we go in to help, they've got the policies, but are the policies enforced? Are people aware of the policies? Absolutely not. So the policies are basically sitting in the policy and procedure manual. There's nothing posted in the workplace about acceptable behaviors. There's not even on the staff meeting agendas, there's nothing to talk about team relationships and working together. So I think we have to make those policies alive. We need to really develop good implementation strategies for making the policies viable and communicated throughout the organization. And we really do support that zero tolerance approach to all forms of bullying, really clearly outlining the acceptable and non-acceptable behaviors and making sure staff understand that and making sure that we all know that there's consequences to unacceptable behaviors. One of the other major things that an employer should do to actually look at the incidents and understand the prevalence in their organization is to conduct a needs assessment, workplace survey, to understand the organizational attitudes and practices. They're also responsible for developing and implementing a reporting and investigation process. Other reporting options if the perpetrator is a supervisor. If there is the incidence of bullying, harassment, what frontline worker is going to, and the supervisor is the perpetrator, what frontline worker is going to report that to their supervisor? So we need to have that biased, third party, unbiased, that the employees feel welcome to report these incidents. It's usually done through an HR department in a larger organization, and in the smaller organizations, it needs to be defined, but very few employers have that, or if they have it, it's not well communicated. We need to provide a support system for staff and a conflict resolution process and make sure that that's being reinforced. Supervisors and managers need to be trained in how to enforce the policy and deal with complaints and situations and be accountable for the investigation and the follow-up. And we have to ensure that all staff are educated in bullying and discrimination and harassment policies. Supervisors specifically have to enforce. Their real responsibility is for enforcing at their unit level, making sure that there's training and education, consulting with human resource professionals as required, especially where there's issues of harassment, or even in recognizing an excessive amount of grievances in the unit to try to get down to root cause. Provide staff with regular education, providing education sessions on bullying to raise the awareness and understanding, encouraging staff to report. And this is largely done by building that awareness and then building a forum for regular communication so that workers are able to bring it forward and talk about it, especially new workers who are very hesitant to raise this issue, especially because the majority of their colleagues may have much more seniority. So they often feel that they're the silent victim, and that's very concerning. There should also be a mechanism by which all complaints are welcomed and they're taken seriously through a proper and thorough investigation, and then communication back to the person who has reported it. Also have a responsibility in monitoring staff behaviors and the general climate. And you can do that by survey or especially in the larger institutions where nurse managers have several units that they're managing. And ensure staff who have bullied others receive counseling. Often they've got some issues as well. Investigate all complaints promptly and provide support and make appropriate referrals as required. And one thing that's, fairly hard, and when we look at the leaders in healthcare, nurse managers or directors, often, in healthcare, we have actually been frontline workers, moved up to nurse managers, to director levels with very little education on managing people. So I think that is still a gap. And we have to make sure that we get that support from employers to which really transcribe into how to properly manage our staff with fair, equitable, and transparent management practices. Involves staff in decision-making, the collaboration with staff, making it an agenda item at your staff meetings, talking about the climate, talking about the culture, making sure that there's that open dialogue, and then creating strategies to improve staff morale, to actually build teamwork at the unit level. Employees also have responsibility. They have to clearly and publicly confront the behavior, and that's easier said than done. Promptly reporting the incident to either their supervisor or that independent third party or unbiased third party at the organizational level. If it's not reported, it's not going to be dealt with. And I think if the employer and the supervisors are really making or lots of efforts to welcome the reporting, I think this will go a lot longer in terms of employees feeling that they can report the incidents of bullying or harassment. Making sure that they're documenting the episode on the employee incident or event form, and then consulting with the union and the Joint Health and Safety Committee would be key to follow up, especially if the victim or the worker does not feel that they could report this to their supervisor. Of course, use of the organization's EAP and to seek medical attention as required, which would then constitute a WSIB claim. So I haven't gone into a lot of detail, but we have a lot of resources that are free as a download. These particular resources, Bullying in the Workplace, which I co-authored with one of my colleagues, is available. These documents were actually funded by the Ministry of Health and Long-Term Care in 2009. The Addressing Domestic Violence in the Workplace, that's actually now in its second edition. We actually had it sent out pan-Canadian for feedback by experts in domestic violence in the workplace through the Ontario Women's Directorate, and then working in the community. Excellent resources. Posters that are free for download. The Workplace Violence Prevention DVD that actually addresses all 4 types of violence has been recently updated, funded by the Ministry of Health and Long-Term Care with the new legislation. So that's coming out in the next couple of weeks. And then Ministry of Labour, under the OSHCO committee that I chaired, Ministry of Labour representatives were largely the ones that have actually developed this resource, which actually was just posted today on the Ministry of Labour website. So workplace resource, developing workplace violence and harassment policies and programs, and then the workplace violence assessment document, which you can download free of charge. Through the group that I chaired, we also developed a number of pamphlets. Key, the booklets are so big. The pamphlets actually are excellent at describing, first of all, the legislation. So this one deals with the new legislation and the implications of the new legislation on employers. Domestic violence in the workplace, what employers need to know. Domestic violence in the workplace for victims or the frontline staff. And you can see there that's available in multiple languages. And then also a fast fact on the new legislation. And the violence and harassment policies, that's what the guide looks like that you can download free of charge, and the assessment. Thank you.